Welcome to another practice question video. At the end of the video, sign up for free daily practice questions and free bonus nursing printables. Now let's begin. Starting with question 1. The nurse is caring for a male client diagnosed with a cerebral aneurysm who reports a severe headache. Which action should the nurse perform? Sit with the client for a few minutes. Administer an analgesic. Inform the nurse manager. Call the physician immediately. The correct answer is call the physician immediately. A headache may be an indication that an aneurysm is leaking. The nurse should notify the physician immediately. Unruptured cerebral aneurysms are asymptomatic and are therefore unable to be detected based on history and physical exam alone. However, when ruptured, they commonly present with a sudden onset, severe headache. This is classically described as a thunderclap headache or worst headache of my life. In 30% of patients, the pain is lateralized to the side of the aneurysm. Next question. During recovery from a cerebrovascular accident, a female client is given nothing by mouth to help prevent aspiration. To determine when the client is ready for a liquid diet, the nurse assesses the client's swallowing ability once each shift. This assessment evaluates A. Cranial nerves 1 and 2. B. Cranial nerves 3 and V. C. Cranial nerves 6 and 8. D. Cranial nerves 9 and 10. The correct answer is cranial nerves 9 and 10. Swallowing is a motor function of cranial nerves 9 and 10. Cranial nerve 9, glossopharyngeal nerve, is responsible for motor, SVE, innervation of the stylopharyngeus and the pharyngeal constrictor muscles by the nucleus ambiguus. Damage to the recurrent laryngeal branch of the vagus nerve can result in vocal hoarseness or acute dyspnea with bilateral avulsion. Next question. A nurse on the newborn nursery floor is caring for a neonate. On assessment, the infant is exhibiting signs of cyanosis, tachypnea, nasal flaring, and grunting. Respiratory distress syndrome is diagnosed, and the physician prescribes surfactant replacement therapy. The nurse would prepare to administer this therapy by A. Subcutaneous injection. B. Intravenous injection. C. Installation of the preparation into the lungs through an endotracheal tube. D. Intramuscular injection. The correct answer is installation of the preparation into the lungs through an endotracheal tube. The aim of therapy in RDS is to support the disease until the disease runs its course with the subsequent development of surfactant. The infant may benefit from surfactant replacement therapy. In surfactant replacement, an exogenous surfactant preparation is instilled into the lungs through an endotracheal tube. Next question. A nurse is assessing a newborn infant who was born to a mother who is addicted to drugs. Which of the following assessment findings would the nurse expect to note during the assessment of this newborn? A. Sleepiness. B. Cuddles when being held. C. Lethargy. D. Incessant crying. The correct answer is incessant crying. A newborn infant born to a woman using drugs is irritable. The infant is overloaded easily by sensory stimulation. The infant may cry incessantly in posture rather than cuddle when being held. Next question. The nurse is caring for a client who suffered a smoke inhalation injury. The carbon monoxide report reveals a level of 35%. Based on the level, which of the following signs should the nurse expect in the client? A. Seizure. B. Confusion. C. Flushing. D. Coma. The correct answer is confusion. Signs and symptoms of carbon monoxide levels between 21 to 40%, moderate poisoning, include hypotension, tachycardia, headache, drowsiness, confusion, nausea, and vomiting. Mental status changes such as altered level of consciousness, disorientation, and memory loss may occur. Next question. A client is undergoing fluid replacement after being burned 20% of her body 12 hours ago. The nursing assessment reveals a blood pressure of 90/50 mm Hg, a pulse rate of 110 beats per minute, and a urine output of 25 milliliters over the past hour. The nurse reports the findings to the physician and anticipates which of the following orders? A. Increasing the amount of intravenous lactated Ringer's solution administered per hour. B. Transfusing 1 unit of packed red blood cells. C. Administering diuretic to increase urine output. D. Changing the 4 lactated Ringer's solution into dextrose in water. The correct answer is increasing the amount of intravenous lactated Ringer's solution administered per hour. The client's urine output indicates inadequate fluid resuscitation. Hence, the physician would order an increased amount of lactated Ringer's solution administered hourly. Patients with burns of more than 20% to 25% of their body surface should be managed with aggressive fluid resuscitation to prevent burn shock. Urine output of 0.5 milliliters per kilogram or about 30 to 50 ml/hr in adults and 0.5 to 1.0 ml/kg/hr in children less than 30 kilograms is a good target for adequate fluid resuscitation. Next question. A client taking probenecid is complaining of gout pain. Which of the following medications should the nurse expect to be administered? A. Acetaminophen, Tylenol. B. Aspirin, Ecotrin. C. Orphenadrine, Norflex. D. Tizanidine, Zanaflex. The correct answer is acetaminophen, Tylenol. The concurrent use of anti-gout medications and aspirin causes an increase in the uric acid level in the body. The client should be instructed to use acetaminophen, Tylenol, if prescribed rather than aspirin. Next question. A client has just been prescribed methotrexate, Trexall, for the treatment of rheumatoid arthritis who did not respond to any other treatment. An important reminder for the client is to A. Clay-colored stool is a normal response to the treatment. B. Pregnancy is not contraindicated with the use of the medication. C. Strict hand washing. D. Get a daily source of sunlight during the day. The correct answer is strict hand washing. Clients taking methotrexate are more likely to get infections or may worsen any current infections. Therefore, hand washing will help to prevent the spread of infection. Next question. The nurse develops a counter-transference reaction. This is evidenced by A. The client feels angry towards the nurse who resembles his mother. B. Focusing on the feelings of the client. C. Confronting the client about discrepancies in verbal or nonverbal behavior. D. Revealing personal information to the client. The correct answer is revealing personal information to the client. Counter-transference is an emotional reaction of the nurse on the client based on her unconscious needs and conflicts. Counter-transference, which occurs when a therapist transfers emotions to a person in therapy, is often a reaction to transference, a phenomenon in which the person in treatment redirects feelings for others onto the therapist. Signs of counter-transference in therapy can include a variety of behaviors, including excessive self-disclosure on the part of the therapist or an inappropriate interest in irrelevant details from the life of the person in treatment. A therapist who acts on their feelings toward the person being treated or that person's situation or engages in behavior not appropriate to the treatment process may not be effectively managing counter-transference. Last question. A 17-year-old gymnast is admitted to the hospital due to weight loss and dehydration secondary to starvation. Which of the following nursing diagnoses will be given priority for the client? A. Altered self-image. B. Fluid volume deficit. C. Altered nutrition less than body requirements. D. Altered family process. The correct answer is fluid volume deficit. Fluid volume deficit is the priority over altered nutrition since the situation indicates that the client is dehydrated. Supervise the patient during mealtimes and for a specified period after meals, usually 1 hour, to ensure compliance with the dietary treatment program. For a hospitalized patient with anorexia, food is considered a medication. Liquids are more acceptable than solid. Fluids eliminate the need to choose between foods, something the patient with anorexia may find difficult. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.